Kerry Courneya, Ph.D., is a professor and Canada Research Chair in Physical Activity and Cancer in the Faculty of Kinesiology, Sport and Recreation at the University of Alberta in Edmonton, Canada. He received his BA and MA in kinesiology from Western University in London, Canada, and his Ph.D. in kinesiology from the University of Illinois, Urbana-Champaign. He spent 5 years as an assistant associate professor at the University of Calgary before moving to the University of Alberta in 1997. Professor Courneya's research program focuses on the role of exercise after a cancer diagnosis, including how exercise might help cancer patients prepare for treatments, tolerate and respond to treatments, recover after treatments, and improve long-term outcomes. So without further ado, Kerry, the floor is all yours.
Thank you, Phil. All right, I think I'm approved to share here, so I'll go. Phil, how's that look? You can see the screen okay? Okay, excellent. Well, thank you again for the invitation. It's a pleasure to be here and share with you some of the research we're doing in exercise and prostate cancer. Just to give you an outline of my talk, I'm going to talk a little bit first about exercise across the whole prostate cancer continuum. I know many of you are on active surveillance right now, but we've looked at a lot of research on exercise during treatments, after treatments, and so on, and I want to share that with you today. The main focus will be our recent study. This is the one that's gotten a lot of attention in the literature, a lot of interest from the urologists as well as men who are on active surveillance. We called it the ERASE trial. And then I'll share with you another trial of involved prostate cancer patients who are on treatment called the PREVENT trial. And then a cohort study looking at the role of physical activity in potentially improving long-term survival. I'll then cover the exercise guidelines for prostate cancer patients, and I'll look forward to any questions or comments you might have about exercise and my talk today. So when we think about exercise after a cancer diagnosis, the way most exercise researchers think is we divide it up into exercise before treatments. And the term that's used here is prehabilitation, trying to help patients prepare for these treatments, typically surgery, but it can be other treatments as well. Exercise during treatments like radiation therapy, chemotherapy, androgen deprivation therapy. Exercise after treatments, the rehabilitation angle. Exercise during survivorship, so starting to look at long-term health, long-term outcomes. We even do research in patients with advanced cancer. But what about active surveillance? You guys don't seem to fit into any of these categories. You're not really prehabilitation because we don't actually know yet whether or not you will be getting any treatments. Probably not really in the survivorship phase. You don't think of yourself as survivors at this stage. So active surveillance is kind of a new area in the whole cancer realm. And it's also a new area for exercise researchers. We haven't really done studies focused on active surveillance. So I'm going to present some studies, as I mentioned, looking at both active surveillance, but also during and after treatments. Because we know that about 30% to 50% of men who are on active surveillance will progress at some point during active surveillance and will need treatments. And I really want to share with you today the importance of exercise throughout the prostate cancer continuum while you're on active surveillance, but in the possibility that you move on to treatments, exercise can play a really important role at that time as well. So the study we conducted that really generated the interest and really one of the first ones to focus on exercise during active surveillance, we called it the ERASE trial. And it was led by my former PhD student, Dong-Woo Kang, who's now at Dana-Farber Cancer Institute in Boston. This was kind of the basic rationale and idea for the study. We wanted to look at exercise as a way of improving physical conditioning in men, in particular cardiorespiratory fitness. And our theory was that that improvement in fitness from exercise might improve some of these biological outcomes that could influence tumor progression. So things like immune function, metabolism, inflammatory markers, and so on. All these things are known to slow the growth of cancer. So our hope was that exercise through these biological pathways could slow the progression of these small, low-grade tumors. And if that happens, of course, men would remain on active surveillance longer, which of course would improve survival. It reduces treatment costs and improves their quality of life. But we also recognized a potential psychological pathway to remaining on active surveillance. And this was what we called the psychological pathway. So we thought exercise could also help these men manage psychological distress, anxiety, and worry, help them get a sense of control over cancer and reduce misinterpretation of different symptoms, ultimately lowering what we call fear of cancer progression. And this is common in many patients who have been diagnosed with cancer and have been successfully treated. They have this fear of cancer recurrence, and psychologically, it can be very distressing. Obviously, in active surveillance, the fear is that the cancer will progress. And we know that some men will actually seek treatment because of that. So it's almost more to manage the anxiety or the distress than it is for the tumor itself. So even fear of cancer progression can influence these treatment decisions. So this is another pathway we thought exercise could improve quality of life and help men remain on active surveillance. Then the last one at the bottom we call the functional pathway. And this is this whole idea of prehabilitation. And so if you're exercising during active surveillance and you're improving your condition and your fitness to be able to withstand these treatments if you need them, that might also reduce your concern about treatments or your fear of the cancer progressing, knowing that you're in the best possible shape you can be in if you do indeed need treatments at a later point. So we think this kind of approach as well, helping men get as fit and strong as they can in anticipation of the possibility of treatment, could also reduce their stress and help them remain on active surveillance longer, knowing that, hey, I'm ready for this if I do need treatments at some point. So these are the three kind of pathways we thought exercise might be particularly helpful for men on active surveillance. So the study we did was recruiting men with prostate cancer on active surveillance. And, you know, we approached 361 men. Lots were excluded because they lived too far away. They had some serious medical issues or they were already exercising. And then out of those men that were eligible, 124 declined. Some were not interested in exercise. Some we couldn't contact. Some felt they were too busy. A big commitment to participate in a study like this where we're doing 12 weeks of supervised exercise with different fitness tests and stuff as well. So it's a big commitment. We ultimately ended up randomizing 52 men in the study. 26 were randomized to what we call the high intensity interval training group. And I'll talk about that intervention in a moment. And we had fantastic adherence. 24 of the men attended more than 80% of their exercise sessions. And I think the mean adherence was well over 90%. 26% of the, or 26 of the men were randomized to the usual care group, where we asked them not to change their exercise during those 12 weeks. And they received exercise afterwards, after the study was done. And we had a really good completion rate in the study as well, collecting blood measures, measures of peak oxygen consumption, as well as questionnaire data assessing their quality of life and symptoms. So the intervention we asked these men to do was 12 weeks. It was supervised. It was 3 times per week where they came into our fitness center. And we did what's called a high intensity interval training program. And this is really a way of helping anybody get sort of small bursts of high intensity exercise. Because generally speaking, we see in the literature that higher intensity exercise induces more benefits. But it's very hard to do high intensity exercise for a long period of time, you know, for 30 minutes straight or 40 minutes straight. So sometimes doing these shorter intervals can be a great way of getting some of this benefit of high intensity exercise without having to do it continuously. So you can almost think of this like a bolus infusion of a large quantity of exercise. And we did this one, and there's all sorts of different protocols you can do. The intervals can be different lengths, different intensities, and so on. But this one was 2 minutes of high intensity exercise, followed by 2 minutes of lighter intensity exercise. And you can see here we did 8 of these intervals over the course of the exercise session. One simple way of thinking about it is walking is the light intensity exercise and jogging is higher intensity. So these men sort of walked for 2 minutes, then jogged for 2 minutes, walked for 2 minutes, jogged for 2 minutes. So it's not that hard to do high intensity interval training. All we're really saying is you're changing the intensity from a lighter intensity to a higher intensity. You can do this on a cycle ergometer. You can pedal slowly for a little bit, and then you can pedal quickly for a bit. You can increase the resistance when you're pedaling, or you can reduce the resistance. So it's just kind of shaking it up a little bit in terms of the intensity levels. So that was the intervention that we did. And the first paper we published from that study was reporting the effects of the exercise on their cardiorespiratory fitness, which we know is a very important marker of cardiovascular disease and cardiovascular function. And we also reported biochemical progression. And that was one of the key things we were interested in this particular study. So we did show improvements in fitness that we expected. The men who did the HIIT training went up by 0.9 milliliters per kilogram per minute. Those who didn't train lost a little bit of fitness over the course of 12 weeks. Turned out to be about a 5% difference in their cardiovascular fitness over the course of 12 weeks. So a reasonable improvement in fitness, and some of these men were already fairly fit. But the most important findings and the novel findings were related to PSA levels. And you guys know a lot about PSA levels. You probably live and breathe that since the time you were diagnosed. What we found in this study, and the first study really to report it, is that the exercise group had a reduction in their PSA levels compared to the usual care or no exercise group, a statistically significant difference where their PSA levels were lower. Even PSA doubling time also was different between the groups. So in the men who exercised, it took longer for their PSA to double. 80 months was the estimate as opposed to 60 months in the men who didn't exercise. And in panel C, we report the velocity of change. And you can see here the group that exercised, their PSA was increasing more slowly compared to the men who didn't exercise. And no change in testosterone levels in this group. Even more importantly, we're able to look at prostate cancer cell lines. So the way this type of research gets done is we can take prostate cancer cells and put them in a petri dish. And then we expose those prostate cancer cells to the serum blood of the men who exercised and the men who didn't exercise. And we can look at how rapidly those cells grow. And what you can see here in panel A from the HIIT group is the prostate cancer cells that were exposed to the serum in the men who exercised grew much more slowly and had less growth compared to their baseline, where the men who didn't exercise had more growth of their prostate cancer cells and no real change compared to baseline. So this suggests that there's something in the blood or the serum of the men who exercised compared to those who didn't. And we suspect it's things like immune function, natural killer cell cytotoxic activity, T cells and B cells, some of these growth factors like insulin and insulin-like growth factor, inflammatory markers. So a lot of these kind of growth factors that are in the blood are anti-tumor and anti-cancer cell effects of exercise. So very exciting and suggesting that exercise might be slowing the growth of these prostate cancer cells.
Dr. Courneya, sorry.
Yes.
I was wondering if you could enlarge your slides a bit. So like, you know, the top right corner, the arrows, you're moving towards it. Yes,
right here?
that. Yes, could you try that, please?
Is that better?
Yes, I think that's better. Thank you so much.
Thank you for the advice. No, I appreciate the feedback. So that got a lot of attention in the literature. Can working out slow prostate cancer progression? So the media was very interested in this. The urologists and certainly the prostate cancer patients themselves were very interested in this, because when you go on active surveillance, there's nothing that's really done for you other than show up and get your testing done, get your monitoring and surveillance done, but there's nothing really you can do to try and help yourself. And this is one of those examples where perhaps there is things you can do to help yourself when you have prostate cancer and you're on active surveillance. From that same study, we also reported on what we call the patient-reported outcomes. So things like anxiety, fear of cancer progression, quality of life. So this is from the same study, but rather than looking at the biological outcomes and the fitness outcomes, we wanted to look at those issues related to the psychological outcomes. And here, once again, we report some very exciting effects. In panel A here is total prostate cancer specific anxiety. So this is the anxiety that these men have about having prostate cancer. And you can see here it gets reduced in the exercise group compared to the no exercise group. And then this total prostate cancer specific anxiety is broken down into different categories. One is related to the prostate cancer itself, no real change there. One is anxiety related to the PSA, very low to begin with here, no difference there. And the other sub kind of category they look at is the fear of cancer progression. And this is where we really had the impact. So the exercise group had much less fear of their cancer progressing after exercise compared to the no exercise group. And this is without them knowing the results of the study. So at this time, they weren't aware what impact exercise might be having, but they still had less concern and less stress over the progression of the disease, possibly because they felt like they were doing something, had more control over their disease. We also looked at more general outcomes. So this anxiety here, panel A, is general anxiety, not about prostate cancer specifically. No real change there. However, reductions in stress in the exercise group, statistically significant. Improvements in fatigue here in panel C. Going up means better management of fatigue, less fatigue compared to the intervention group. Fatigue is a common complaint in many cancer patients and even for men on active surveillance. And lastly, improvements in self-esteem. So overall, how these men felt about themselves improved with exercise. So much to our surprise, this study also got a lot of media attention. In fact, in some ways, it got more attention than our initial study. There were some urologists that were more excited about the findings here, helping these patients manage anxiety and stress than even the findings related to PSA and fitness. And we know from doing these studies that many cancer patients themselves will tell us that the psychological benefits of exercise are even more important to them than some of the physiological and potential disease-related benefits. So a very important finding from this particular study. Now, as I mentioned, 30% to 50% of men on active surveillance progress at some point, but you don't need to distress or worry about that in terms of treatments and exercise and the role it might play. We've done a lot of studies for men who have been treated for prostate cancer patients, and there's lots of good benefits there. So this is a study where we compared aerobic exercise and resistance exercise in men who are receiving radiation therapy for prostate cancer. We called this the PREVENT trial, and it was a randomized control trial. So just like the ERASE trial, except this was a 24-week intervention, and we compared AET, so aerobic exercise, to RET, resistance exercise or weight training, to a usual care group. And we looked at fatigue, quality of life, and fitness. We recruited 121 prostate cancer patients who were receiving radiation therapy and also on androgen deprivation therapy. And we know exercise is one of the best interventions for prostate cancer patients who are on androgen deprivation therapy. Again, it was a supervised exercise program. These guys did 3 exercise sessions per week on a bike, a treadmill, or an elliptical. And this was more of a continuous exercise program, continuous intensity. So they started off kind of light to moderate and progressed to moderate to vigorous intensity exercise. But it wasn't interval training, more your standard exercise program. For strength training, they also did 3 sessions per week, 2 sets of 8 to 12 repetitions of 9 different exercises, and covered all the major muscle groups. Again, usual care group, no structured exercise. Fantastic adherence for both the aerobic group and the strength training group. As you'd expect, improvements in upper body strength. The group that did the weight training intervention increased their strength by over 20% compared to baseline. We would expect to see that. Same with lower body strength. So this is your leg press measure. Again, almost 25% improvement in muscular strength over the course of these 24 weeks on the exercise intervention. And even maintenance of aerobic fitness. The group that didn't exercise, they saw a very big decline in their fitness over the course of this treatment. And we see this in a lot of studies on cancer patients who are on chemotherapy and other treatments. Fitness declines during these treatments. And here, the exercise groups were able to maintain that fitness. Fatigue, as I mentioned, a very important and common side effect. The group that didn't exercise, their fatigue got worse over the course of radiation therapy, whereas the 2 exercise interventions prevented any issues related to fatigue. At 12 weeks and at 24 weeks, similar pattern where the strength training group actually improved, had less fatigue after these 24 weeks, even though they've been on treatments for RT and ADT. Same pattern with overall quality of life. Reductions during the first 12 weeks when these men are on treatment that are offset by the exercise program, and then improvements in the second 12 weeks of the study. The last study I'll share with you is a observational or a cohort study looking at survival. So exercise can improve quality of life, it can improve symptoms and side effects, it can improve your fitness and might even improve disease progression. But the ultimate outcome that many people are interested in, what are the implications for survival after prostate cancer? This is probably one of the best studies that looked at this particular issue. And what we did is we recruited 830 men who were newly diagnosed with stage 1 to stage 3 prostate cancer. This is back in the late 90s. And we followed them up for till 2014. So this was about 17 years of follow-up. And we assessed their physical activity at the time they were diagnosed, as well as every 2 years after that. And so we could quantify how much physical activity they did from the time of diagnosis through these many years of follow-up. And we looked at physical activity as a predictor of their survival and adjusted for other known factors like the disease, the stage of the disease, the treatments they had, and so on. And over the course of this follow-up, there were 577 deaths, 236 from prostate cancer, and 401 recurrences. And what we found here is the men who did the least amount of exercise, we just set their relative risk of death to 1, and we can look at what's the risk of death by the different physical activity levels. And as you can see here, as physical activity increases, the relative risk of death overall, so from any cause, but also from prostate cancer itself, gets reduced. 5 to 13 med hours a week, that's not even meeting the exercise guidelines. Less than 5 hours a week here, this is less than maybe 75 minutes of walking a week. So a small amount of exercise there. Here's kind of around the guidelines, and you already get a significant reduction. The guidelines will recommend around 10 hours per week, and 10 to 20 is the range. So you can see here at the upper range of the guidelines, you even get further reductions down to about a 40% lower risk, and even a bit further improvements as you get above the exercise guidelines, especially related to prostate cancer deaths where it's almost cut in half. So the most active men had about 50% lower chance of dying from prostate cancer during a 17-year follow-up compared to the least active men. If we look at that in survival curves and look at total physical activity, the top graph here, A, is survival, overall survival, so mortality from any deaths. And you can see the top blue line here, that's a hash blue line. These are the most active men, the top quarter, the 25% most active. And these are the least active, so the bottom 25%. And you can see a dramatic difference in survival rate over the course of these 17 years, with the most active men being far more likely to be alive 17 years later compared to the least active. And the same pattern for prostate cancer specific deaths. So exercise not only helping with overall deaths, many of them due to cardiovascular disease, but also deaths related to prostate cancer. So the take-home message is don't take cancer lying down, and specifically don't take prostate cancer lying down. Exercise will have a lot of benefits related to prostate cancer. And so this is generated guidelines in the field. These are guidelines from the American College of Sports Medicine that is recommending exercise for cancer survivors. These were first published in 2010, updated 2019. And these are hot off the press. 2022, they're only published a week or two ago. These are the updated guidelines from the American Cancer Society for nutrition and physical activity. And again, strongly endorsing physical activity for cancer survivors as a way of lowering the risk of recurrence, improving survival, and then improving symptoms and quality of life as well. So a very strong endorsement. So what are some of the general exercise principles that we can follow? First of all, avoid inactivity. Generally, some exercise is better than none. It's not an all or nothing type of proposition where you have to say, well, if I can't do it 5 times per week, I might as well not do it at all. Avoiding inactivity is very important. Generally, we find that more exercise is better. So we call that a dose-response association. You saw that in one of the graphs there, where the more exercise you do, the stronger the benefits. Start easy and progress slowly. That's very important if you've not been exercising. You can't go out and just start right off doing a high intensity, high volume exercise program. Start off easy and progress it slowly. Ultimately, exercise must be individualized based on patient functioning, side effects, preferences, and goals. But I'll give you some basic guidelines. But the key point that many people make is the best exercise is the one that you will do. So it's not about, is this better than that? Is that one better than that? It's what will you be willing to do and stick to? Because the benefits of exercise really come from the long-term adherence, doing it over the longer term. It's not a short-term fix. You can't gain over the next few weeks what you haven't done over many years. It's a lifestyle change that you want to do for the rest of your life. So think about adopting an exercise program. What am I willing and able to do for the rest of my life? Not for the next 12 weeks. So exercise prescription components. What do we talk about when we talk about exercise? Well, it's the type or mode of activity. So this is your question, what exercise should I do? It's the total weekly amount or volume. So this is the question, how much exercise should I do? Frequency, intensity, and duration is how you get that amount of exercise. How often should I do it? How long should I do it for? What intensity should I do? And lastly, which doesn't get talked about as much, is the context of exercise, the physical and social environment. Does it really matter where and with whom I exercise? And I'll make an argument here that I think that it's very important. So let's start off with the type or mode of activity. The two main modes are aerobic or endurance exercise and strength or resistance exercise. So aerobic being your walking and jogging, your cycling, those sorts of things. And of course, strength training basically being your weightlifting, body strength exercise, push-ups, sit-ups, those types of things. Both are always recommended because they're complementary. They address different aspects of physical functioning and sometimes have complementary changes, not just in fitness parameters, body composition parameters, but other biological parameters as well. But that's a lot to ask to do both. I mean, it's hard enough to do an aerobic exercise prescription or a strength one, let alone both. The good news is either one alone is very good. You saw that in the study where we compared aerobic to strength. And that's not the only study we've done that in. Lots of studies compare aerobic to strength. Both of them are very good. Sometimes in the studies, we see the combined one is a little bit better than either one alone. So this is why we recommend both if it's feasible. But you can think about an exercise prescription like good, better, and best. right? So when I say both types are recommended, that's kind of your optimal, your best program. If you have the time and you have the energy and really value exercise, then doing both is fantastic, but you don't need to get these benefits. So that's what we recommend, but specific type beyond that, there's no recommendation. There's no study saying, you know, walking is better than cycling or cycling is better than swimming or any of that type of thing. So we don't get down to that specificity. This is where, you know, doing an exercise you enjoy becomes important. Variety is encouraged. Don't feel like you have to do the same thing every time. Don't feel like, I got to do the elliptical every time, or I got to do the treadmill every time, or the bike. Change it up. Cross-training, different types of equipment, different types of exercise is very important and has a lot of benefits. And if you don't have any strong preference, walking is one of the best exercises. We've done surveys of thousands of cancer patients and survivors, and the majority of them say walking is the preferred activity. You can get lots of benefits just from a walking program alone. Exercise volume or dose, what do we recommend? So the range we recommend is 150 to 300 minutes per week of moderate intensity aerobic exercise. And I'll talk about intensity in a moment. Now, we give roughly double the credit for vigorous intensity. So if you're doing the higher intensity exercise, the recommendation is 75 to 150 minutes. But once again, it doesn't have to be one or the other. It can be both. You can have one day where you jog and you can have a different day where you walk. So you can mix up the intensity as well. And we see this with cross training. We see this with the high intensity interval training program I talked about. And then for the strength training, 2 to 3 days per week of strength exercises is recommended, with at least one day between the strength exercises. How do you get that 150 minutes per week? Once again, how you slice it up doesn't seem to matter. So you have a lot of flexibility and a lot of choices. We do kind of recommend a minimum of 3 days per week. And so the range is 3 to 7 days per week. You don't want to get it all at once. We refer to that kind of as the weekend warrior, you know, the guy who does nothing all week and then goes out and you know, hiking for 4 hours or out golfing for 4 hours and try and get all the activity in one day. And the problem with that is there's risks of injury and it's not kind of a progressive program. So we do recommend you spread it out at least over 3 days, but up to 7 days. You can exercise every day. So for example, to get the 150 minutes, it could be 3 days at 50 minutes, it could be 5 days at 30 minutes, it could be 7 days at 21.5 minutes or whatever it works out to be there. We generally recommend durations of at least 10 minutes. So if you're trying to get 30 minutes a day, again, you could do 3 times in a single day for 10 minutes, or twice in a single day for 15 minutes, or once times 30 minutes. So how you even get it in a single day can break up the activity. So intensity is probably one of the key components that we do recommend at least moderate intensity exercise. That doesn't mean that light intensity has no benefits, but in all this research, we're oftentimes testing at least moderate intensity exercise, and that seems to be what generates the most benefits. There's all sorts of ways of kind of judging whether you're doing moderate intensity. You can go do a fitness test at a fitness center. So if you want an expert evaluation of your fitness and get a prescription that's based on your VO2 peak, you can go get a fitness test. If not, you know, 65 to 75% of your heart rate maximum, and a crude estimate of that is 220 minus your age. So just take 220, subtract your age, and then calculate 65 to 75% of that. Another rule of thumb that we use is 100 steps per minute. So if you've got a step counter or you're walking on a treadmill, you know, if you're accumulating about 100 steps per minute, you're probably doing moderate intensity exercise. So this would be about 3,000 steps in 30 minutes. So set your step counter, your pedometer, whatever you have, your Fitbit, go out and walk for 30 minutes and check your steps. If you've got 3,000, you're probably in the moderate zone. The other way we describe it, you know, light sweating increased heart rate and breathing rate. You should notice some physiological response is going on. You can tell your body is being physiologically challenged. I'm breathing a bit heavy. I'm breathing more quickly. My heart rate's up. I'm sweating a little bit. And sometimes we say you can talk but not sing. So if you can sing while you're doing the activity, that's light intensity activity. And there, you know, what I'm really trying to get away from is, say, people are out walking the dog. Right? You're out walking the dog and you've got a coffee in one hand while you're walking the dog, right? That's going to be light intensity activity. That's not going to be moderate intensity. Brisk walking, if somebody saw you walking, they'd think you're late for an appointment. And the other rule of thumb I sometimes tell people is, you know, when they tell me what they're doing, I ask them a very simple question. Do you change your clothes before you do it? And do you shower afterwards? And if they say no, it's probably light intensity activity. So if you go out for a walk and it's your clothes that you would wear to work or your clothes that you normally wear, come back and you don't feel the need to shower afterwards, you've probably engaged in light intensity. Again, that's beneficial, it's recommended, but it's not the moderate intensity. So you're looking at change my clothes, I shower afterwards, I'm probably getting a good workout where I'm maximizing some of these benefits. Lifestyle activities. These are encouraged in addition to meeting the exercise guidelines. So in addition to trying to exercise, look for other opportunities to become more active. Things like parking at the far end of the parking lot and walking into the store, taking the stairs instead of the escalator when you have a chance, gardening, walking to the bus stop, all these types of opportunities where you can get up and move around and just be a bit more active. I view these kind of like activity supplements. And the same thing in nutrition, right? We don't recommend nutrition supplements to replace a good nutritious diet. It's in addition to that. And same here, we don't recommend moving around to replace an exercise program, but in addition to an exercise program, it can be very helpful. Does the exercise context matter? I think the physical and social environment are important for optimizing the psychosocial benefits of exercise and also for improving long-term exercise adherence. So consider doing exercise that engages the mind and spirit, not just the body. We view those kind of like mindless activities, right? I'm just exercising the body and I'm, say, jogging on a treadmill and my mind can sort of wander anywhere I want, but the activity itself doesn't engage the mind. And sometimes you're able to do this, sometimes not, but it can be very helpful from a psychological benefit. So here's a couple, one simple example to how you might think about this. So walking, here's a bad sort of activity engaging the mind. You've got a treadmill and it's down in your unfinished basement and it stares directly into the insulation in your unfinished wall and it's down in the furnace room and you pop on the 60-watt light bulb when you go down there and you hop on the treadmill. How long are you going to continue to do that? And what's the psychological benefit? So to try and sort of improve that, treadmill while listening to music is a fantastic way of enjoying exercise. Watching TV is one of the best. You set up the cycle ergometer or the treadmill in front of the TV, watch the baseball game, the golf match, very enjoyable. Better yet, walking around your neighborhood, getting outside. Best, walking in a park, hiking with friends, those types of things. So those are just an example. Here's one study we did with ovarian and gynecologic cancer survivors. It was a wall climbing intervention. So this is just a really good example of an activity that engages the mind and spirit. So these women this is the indoor climbing wall at the University of Alberta. And you can see on your right here, this is a 50-foot climbing wall. And so this was our intervention. Twice per week, they came and did this climbing, totally engaging the mind, challenging, novel activity for them. The psychological benefits were through the roof. And they also got a lot of fitness benefits. Climbing a wall is not that easy if you've never done it before. Lots of improvements in cardiovascular fitness and strength, but really profound psychological benefits as an example of an activity that engages the mind. So to conclude, exercise is beneficial during active surveillance and across the prostate cancer continuum. So even if your cancer does progress, and even if you do need to go on to treatments, there's big benefits for exercise helping you prepare for those treatments, maintain your quality of life during those treatments and benefiting from those treatments and recovering after those treatments. Exercise improves both physical and mental health. And this is one of the real unique selling features of exercise. You don't have to choose between the fitness and biological benefits and the psychological benefits. As we showed in the ERASE trial, you can get both sets of benefits just from exercising. And it may, in fact, improve treatment outcomes and survival rates. And this is where a lot of the research is ongoing right now. As I mentioned, select an exercise that you enjoy and can maintain for the rest of your life, and add activity supplements throughout the day. I'll just end by acknowledging the colleagues, students, and staff who have contributed to this research, and of course, the study participants who committed a lot of time to participate in these studies. And also the support I received from the Canada Research Chairs Program, a CIHR Foundation grant, and this ERASE trial was funded by Prostate Cancer Canada, and we're also supported by the Apple Fitness Store. I look forward to any questions or comments that you might have. Thank you.
Okay, let's.
Hey, Kerry. Can I ask a question?
Howard.
Yeah, we hear all this stuff about exercise and diet. I just had my annual meeting with my urologist, and for unexplained reasons, my PHI test, it's a type of PSA, dropped to lowest levels in, I don't know, 12 years, and can't explain it. I would like to exercise regularly, but my wife and I were out in the sub-zero in Chicago a year ago. It's going to be a year and a half. She broke her knee on the ice, and she's still recuperating. And so I guess I've supported her by not exercising much, but at least she goes to physical therapy. But what I'm leading up to is exercise versus diet. So my wife, if she was in the recovery room from her third surgery, I got my latest phi test, and it went down, like I said, 25%. And she said, oh, it must have been the green donuts you had for St. Patrick's Day. But so what's the better choice if you only had one choice, exercise or diet? And what's a good diet anyway?
Yeah, it's a great question, Howard, because, you know, we recommend all sorts of changes, and it can be a challenge to make all of these different changes. So sometimes you're forced to say, what am I willing to change? What am I able to change? And there's not a ton of research on the diet side in the active surveillance setting. I'm sure, Howard, you're familiar with the meal trial. That was the big one.
I was in that trial.
Oh,
and I was totally pissed off because they put me in the control group, and I really wanted support. So I decided to see if I could mess with them. So I lost 30 pounds and did it without their help. And I don't know if the message from that trial is all that great, really, you know?
Yeah, so the good news, Howard, about being in the control group is the intervention didn't work. So
yeah.
You didn't miss out on anything. So for those of you not familiar with that trial, it looked at, I think it was fruit and vegetable intake as the main intervention. So they got these men to increase their fruit and vegetable intake compared to a usual care group, followed them, I think, for at least 2 years. And they looked at progression, you know, on, you know, the different outcomes that indicated patients had progressed. And there was absolutely no difference, no effect whatsoever. They published a separate paper on quality of life, same thing, no impact on quality of life. So that's the biggest trial we have. Now that's only focused on fruit and vegetables. The other studies that have been done in the active surveillance settings, and this is why we did the ERASE trial, is they combined diet and exercise. So there were different, you know, combining exercise with a Mediterranean diet or some other, you know, low-fat diet and this type of stuff. And of course, you can never sort out what helped and what didn't help because it's kind of a packaged intervention. And there's no studies I know of, Howard, that are comparing exercise to diet. But I think what we see in general with cancer patients and other studies as well is the diet doesn't seem to have as big an impact on quality of life, right? When you look at physical functioning and quality of life types of outcomes, those are almost uniquely driven by exercise. But it can influence the different cancer outcomes. And I'm not an expert on the diet side of things, Howard. So hopefully you guys can attend that lifestyle session Howard's talking about if there is going to be someone who's an expert on the
we're going to have Stacy Loeb, who's going to be presenting some information on a study that comes out at the American Urological Association this meeting, looking at plant-based diet.
Yeah.
So, but you know, in my defense, I had donuts on St. Patrick's Day, but they were green. So I was increasing my green intake.
Yeah. And diet is very complicated. And in fact, it's far more complicated than exercise, right? When you get into all the macronutrients and micronutrients, and they've tested the low salt diets and low fat diets and low cholesterol, and they're realizing it's the whole pattern of what, you know, so now they're trying to compare kind of patterns of diet versus each other. But man, you know, studying exercise I thought was tough, but diet's even more complex.
If I can make one comment on both diet and exercise, and I think it's the comment that you made, the idea that all of a sudden once you receive your diagnosis, you're going to go on a plant-based diet and that's going to be terrific and going to change everything, really isn't the goal. I mean, I think the goal is to establish something that you're going to be able to carry out for the rest of your life. And that's what's going to help improve and benefit you.
That's right, because we know, you know, even if men on active surveillance progress, sometimes it's 5, 7, 10 years down the road. And then we know exactly. After that, treatments can go, you know, keep you healthy for many, many years. And then even when you get advanced prostate cancer, many of these guys live 5, 7, 10 years with advanced prostate cancer. So you got a long road ahead of you. And it's not about sort of what's the quick fix in the next 12 weeks. It's what's the lifestyle change that's going to help me through active surveillance, through cancer treatments, possibly, and then even through beyond that.
Yeah, exactly.
We have a hand raised for Anthony, but just to let everyone else know, you can also send your questions in the chat. So yeah, go ahead, Anthony.
Oh, okay. Thank you. And Dr. Courneya, thank you for your presentation tonight. Very illuminating. My comment really is, I'm on active surveillance. And I recall back in 2015 when I was diagnosed, I asked, you know, so should I, since I'm not doing any active treatment, should I be actually making changes anywhere in terms of diet or exercise? And the standard pat answer I got back then was, oh, just enjoy your life, just do your thing type thing. Is there a disconnect there between, you know, what I was hearing then and what you're saying now? Are the doctors, specialists not aware of your studies and these kinds of studies? It just seems like there's a disconnect.
I think different urologists view things differently. Different oncologists view things differently. You know, many of them are focused on treating your prostate cancer. And so they don't feel it's necessarily their job to make general health recommendations. Okay, what they want to know, what is specifically useful for your prostate cancer? And this is why they need to see the evidence for exercise or diet related to prostate cancer patients on active surveillance. So they don't necessarily feel like I'll give a general health recommendation unless it's specifically going to help with the prostate cancer. I'm not going to endorse or make a recommendation. And so this is where we kind of make a distinction between the general health benefits of exercise versus what are the unique or special benefits for prostate cancer patients. And if that evidence is supportive, then urologists might start focusing on that because it's helping the patients that they're managing. And then I think you have other urologists who are happy to give broader health recommendations beyond sort of the specific condition that they're treating. So they might give general health recommendations, even if they don't think it's going to help with your prostate cancer. So those are kind of, I think, a couple different camps. It's a lot of time and effort for them to know how to manage your prostate cancer, right? To be responsible for general health recommendations. They might say, go back to the GP or go see a public health specialist who are going to make general recommendations. And so this is why I think the evidence for prostate cancer is specific. The study that we did got the attention of the urologists because we published it in Journal of Urology and JAMA Oncology, the journals that these clinicians read in order to help treat their patients. So we'll see if this starts to change the recommendations that they're giving to their patients.
Okay, thank you.
Rochelle, is there any, or Maya, is there anything in the chat there that you can read to me? Were there any questions, or should I be opening the chat?
No questions. We have, hi, thank you for this very interesting presentation, going training. So
fantastic.
That's good to hear. But yeah, no other questions. Oh, yes, we do. Okay. So here's one I can read for you. When did Dr. Courneya's interest in physical wellness and exercise find its way to prostate cancer specifically?
Yeah, it's a new area. So when I did my PhD back in the early 90s, this field didn't even really exist. So I was not trained in exercise in cancer. It wasn't until I started my first job where we started to think about exercise in cancer patients. And in part, many years ago, treatments were very difficult. It was hard to exercise during treatments, and side effects weren't well controlled and so on. So there wasn't a lot of interest in that area. And when we first started getting interested in the area, probably in the mid 90s or so, most of the research was in breast cancer. And that's where it started. So a lot of the early trials and still most research to date is breast cancer patients, especially on chemotherapy, radiation therapy, and so on. And then probably around the mid to late 90s, there started to get some interest in prostate cancer. But even there wasn't a lot. And I think we did our first study in prostate cancer in 2003. That was the prevent, sorry, that one was 2009. We did one before that in 2003. So I'd say early 2000s, we started getting interested in prostate cancer after we saw the benefits of exercise in the breast cancer patients.
Thank you.
And as I mentioned, everything in prostate cancer, where we really started was patients on androgen deprivation therapy, right? The ADT treatment, because that seemed like a good fit. So of course, this is a treatment that eliminates testosterone levels down to castrate levels. These men feel very weak. They feel fatigued, deconditioned. And so a weight training intervention seemed like a good fit, and it turned out to be fantastic. The trials have looked at these weight training interventions in men on ADT, great benefits. And that's where kind of the prostate cancer started, and then looking at radiation therapy. But active surveillance is fairly new, and the exercise researchers haven't really picked up on it yet. And so it's still fairly new area to research these lifestyle interventions.
Nice, thank you. And then there's one in the chat and then a hand up, but I saw the chat first. Do you plan a follow-up with a larger population, which is a more inclusive study about exercise?
Yeah, that's a great idea, and we'd really like to do that. What we'd really like to do is do the meal trial, but for exercise. So that trial randomized over 400 men on active surveillance, and it was done, I think, across the US in a bunch of different centers. So that's the type of large-scale trial that we need. And Kellogg Parsons, who was the PI of that trial, he's commented on our study, and I know he's interested in the exercise area as well, in part, I think, because the diet, at least the fruit and vegetable, didn't seem to work very well. And now the exercise data has come out. And he said, yeah, it's a small trial, but it's an exciting trial. So I think the potential for a collaboration maybe between Canada and US, where we can get a very large sample from across many different states, will give us a more definitive answer on the role of exercise in active surveillance.
Thank you. And then, yeah, Howard, you can go ahead.
Yeah, how about a little bit of a reality check here too, in terms of diet, but also heart disease. You know, guys like us like to bitch about, having prostate cancer, even if it's low risk. We focus on that because of the C word. But, our real risk is the H word. It's, you know, it's heart attack, stroke. That's what's going to take most of us out. So isn't that another good argument? And what is the evidence for benefit for exercise and heart health?
Oh, geez.
Yeah, it's a great point, Howard. And again, this really makes exercise a very attractive option. So you're right. Men with early stage prostate cancer, just like breast cancer patients with early stage breast cancer, are more likely to die from heart disease than they are from their cancer. So cancer can distract you and sort of take your full attention. But if it's early stage, like you guys are, your biggest threat is still heart disease, and far less so on the cancer. And I think that's what makes exercise very attractive. The evidence for cardiovascular disease, Howard's even stronger. You know, improving cardiovascular function and all the heart function. We've built it into cardiac rehab so it can prevent the heart disease, and it helps with the rehabilitation component of heart disease. So it's a really good sort of 1-2 punch for these types of outcomes. And we know in the general population, right, the two biggest killers are heart disease and cancer. At least in Canada, and the US data will mirror this, 25% of all the deaths in Canada are from cancer, and about 25% of all the deaths are from heart disease. Those are the two things you have to worry about. And exercise is strongly linked to preventing both of those. So this is why we see these improved survival benefits.
Thanks.
Thank you. And then, so Michael, and then I see Phil has his hand up. So the question in the
well, no, I think
oh yeah,
I'll defer to Scott, because I think my question is very similar to what Scott was talking about. Okay. Just if there's one thing that's good about getting a diagnosis of prostate cancer, especially if you're on active surveillance, it's sort of like the needle in the rear end that gets you to start thinking about lifestyle changes that are going to help you keep going. So
that's an interesting point, Phil. Yeah.
Yeah.
Mm-hmm.
Scott's question is a good one, Mayor.
Yeah. Okay. Then yeah, let's do this first. Yeah. So he's saying, how do we get a medical prescription of 300 minutes a week of time available for exercise time?
So how do you find the time for the exercise?
I think that's what he means. Yes. Yeah.
Yeah. Yeah. Great question. And this is why, you know, you guys have a lot on your plate. You have busy lives. And so you have to think about prioritizing, as Howard said, diet and exercise and all sorts of changes you can make. And even within exercise, you know, well, we recommend aerobic and we recommend strength and so on. It can be a lot to do. So you have to find out what's manageable. One of the simple tips I give is, how much time do you spend watching TV? And if you're like most Americans and most Canadians, and I'll confess to this myself, you're probably watching 25 to 30 hours a week of TV, right? 3 to 4 hours a night. And then on the weekends, you might be watching game. Set up that treadmill in front of the TV. That's how I used to do it. I've changed my exercise program recently, but I have downstairs in the basement, I have my nice little TV there. And what do I do on Saturdays, Sundays evening? I watch baseball games and I watch golf. So I'm going to watch golf for 4 hours. So I can either sit there on my couch for 4 hours, or I can hop on that treadmill or elliptical or bike, whatever you have, and watch the golf while I'm doing my workout, watch the baseball. So you're kind of killing two birds with one stone. You're not missing anything because you'd be watching the television anyways. So to me, that's one of the easiest ways of trying to incorporate exercise into a busy schedule. The other thing I point out in terms of activities is every situation is kind of an exercise session waiting to happen if you begin to think progressively about exercising, right? Everything we do is normally waiting and taking it easy. So when you go to the doctor's office and you walk in there and the secretary says, yeah, the doctor's about a half hour delayed, what do? You sit down in the waiting room and you wait there for the half hour. Why not go out and walk for half an hour and come back? You go to the restaurant and there's a waiting line at the restaurant and they hand you the buzzer and they say, yeah, it's going to be about a half hour. We'll buzz you when it's Everybody sits in the restaurant and waits, right? You can go out for a walk while you're doing that. So think of all those opportunities just to get up and move around. You know, when I watch TV, okay, say you don't have a treadmill or whatever, what I do is I stand up every commercial, and I've got a basement. It's a decent sized basement where it takes me about 50 steps to walk around the basement. So I'm watching my baseball, I'm watching my hockey, whatever it is there, commercial comes on, up I stand, out I go, once around my whole basement, 50 steps, sit back down. Sometimes I can go 2 or 3 times around the basement, sit back down while I'm watching TV. So even little things like that can help you just get up and move more and be more active.
Thank you. And then, so I'll read Michael's question. Are you doing long-term follow-ups of your first mentioned study to see the long-term ages of demise and the causes of demise?
For this erase trial, we did do follow-up, I believe, at 1 year and 2 years. So we are following up these guys to see how many of them go on to active treatment for the disease. But it is a small sample, and that's going to be the limitation in this particular study. We have other studies going on with long-term follow-up as well, but they're in different patient groups. We have one in colon cancer patients, one in breast cancer patients, and one in prostate cancer patients, but these are men with metastatic prostate cancer. So we're doing a longer-term study there, again, a multinational study in that particular patient group.
Thank you. And then I see Rich Landy's question. In regard to the meal study, did it both increase fruits and vegetables and discourage eating red meat and dairy?
Good question. I think it was just about increasing fruits and vegetables. That was the focus of the intervention. And I think the challenge of that study, there was an identical study in breast cancer patients that also did a fruit and vegetable and showed no impact on recurrence rates. But both the studies noted that, you know, the men that were attracted into the study were already eating a fair number of fruits and vegetables as well. So it was really about moving them from a reasonable level to a very high level of fruit and vegetable intake. And it didn't seem to make a difference related to progression of the prostate cancer or to any of the quality of life indicators.
Thank you. And then a funnier one, how much additional exercise time do we need to add if we correlate sweat time to beer time?
Sweat time. Well, you know, beer, we call those 12-ounce bicep curls, right? So you can be doing those. But I mentioned earlier that, you know, the recommended exercise, the best exercise is the one that you will do. And we also have another saying for the amount of exercise. One of our famous exercise scientists says, when people ask me how much exercise they should do, I tell them more. And that's the reality of it. It's very, very hard to do too much exercise. The benefits of doing more exercise, you know, running 10 kilometers and doing that multiple days a week, a very good weight training program. There's just lots of benefits to doing that. So, you know, this is really up to you guys to think about how much do I want to exercise, you know, how much of the benefits do I want from exercise?
Thanks. There's no more questions in the chat. If anyone has anything else they'd like to say right now. No?
Yeah. I'd like to ask a question.
Oh, yes. Go ahead.
Can you hear me?
Yeah, there's a bit of an echo, but it's okay. Yeah, we can hear you.
It's very dramatic, though.
Yeah.
I think God is speaking.
Yes.
Let me get out of one computer. I've got two of them going because one of them doesn't have a camera, and I didn't know how to ask a question. First of all, thank you very much for taking the time to do this. I thoroughly enjoyed your presentation. The main question I have is more exercise always better? It sounded like the more you do, the more neurotransmitters or cytokines or whatever you release, and the better it is for you. Is that true?
Generally speaking, it's true. What we do see is going from no exercise to some exercise, you get fairly dramatic increases in benefits. It does kind of level off at some point and begin to plateau, but usually it never goes back down unless you're crazy amount of exercise. So, you know, you can get into the 26-mile marathons doing those too much. There is such a thing as overtraining and burnout, and you can actually be immune suppressive if there's a super high volume of exercise like marathon running and so on. But short of that level, you know, we always say you can't be too rich and too thin. So I add the third thing, you can't do too much exercise. It's very hard to do that.
Okay, good. All right, well, thank you.
Thank you. I guess then if there isn't really any more questions, Phil, do you have anything to say to end it off?
No, I just want to thank everyone. Dr. Courneya, that was just a tremendous presentation. And I'm sure the guys on AS really appreciate it and are going to benefit from it.
Yes.
So just keep on doing this stuff.
Yes.
Thank you all very much.